Hello class, my name is Taylor Cunningham. For my case study presentation in our ethics class, I decided to look at case 8.2, which is titled Moral Conflict in Clinical Trials, and you can find this on page 432 in our ethics book, and it was written by Mariah Merritt. I actually really enjoyed reading this case study because it relates to the medical field, which is what I'm in school for, kind of. I'm in nursing school, so it was nice to read something that was kind of related to that subject and field. That is kind of why I picked this one. I read through some of the other case studies that were options, and I just found this one the most interesting, so I decided that I would do this one for our case study presentation this week and for next week. So we'll go ahead and start talking about it. In this case study, it talks about a doctor who is performing a clinical trial of a drug that is meant for cancer patients. So all the patients in this clinical trial have some form of cancer, but the one character that this study focuses on is named Ms. Hernandez. Ms. Hernandez has breast cancer, and she also has cancer in 3 other locations in her body. And one of those 3 spots is her liver. This is one of the main reasons they were kind of concerned about her doing the clinical trial, because your liver is very important in your body, and once you go into liver failure, you have also a lot of other complications as well. So for the trial, it consists of the patient having to do 21 days worth of an intravenous cycle of the drug, and they do that 21-day cycle 6 different times. The reason I'm performing this trial was to see if there are any problems with the chemo drug causing buildup of toxins in the patient's body that they are not able to get to go away after the drug is finished and the cycle, or if it's causing the patient any serious harmful side effects. One of the side effects the book stated was like losing sensation in your hands and feet and legs would be a side effect that would be considered serious or harmful. The conflict that we really see arise in this trial is later on when Ms. Hernandez has finished doing her 4th cycle of the treatment. So she did the 21 days 4 different times. And during this time, she had a checkup, and they found that one of the cancer spots had grown by 22%, and that cancer spot was the one in her armpit, not her liver. But they all were still in fear that the other areas may grow as well, and they may grow as quickly as her armpit one did. So obviously they informed her of this news and allowed her to make the decision to whether or not she wanted to continue on finishing the other 2 21-day cycles, or if she wanted to withdraw from the trial. She decided that she wanted to talk to her physician and just kind of figure out from there a game plan and just see what her and her physician both thought together what would be best. Ms. Hernandez also is the last one in this trial that the doctor has of the patients. So he kind of feared that if she did withdraw from the trial, that all of the work and evidence that they had put forward and researched and all the work that they've come through so far with Ms. Hernandez doing this trial would be lost. And that he may not ever get the opportunity to conduct the study or trial again. But he also had the worry that if she does decide to stay, is her health going to stay the same? Is it going to decline? Will she improve? So the main conflict that we really see is that if she does stay, does he let her continue on with the trial knowing it possibly could decline her health, or does he do his protective duty as a doctor and recommend that she goes ahead and withdraws? We can see a moral and ethical issue here because the doctor obviously is going to want his trial to prosper and succeed, but he also knows that he has to worry about Ms. Hernandez and her health. I think that we all can kind of relate to this issue in some way. I'm sure there has been times in all of our lives where we probably really want to do something, or we really want something, but there is always that one thing that's holds you back, or it may be that feeling in your gut, or just that your mind telling you that it's probably not the best option, or your morals just kind of hold you back from doing that. So at the end of the case study in the book, it kind of asked the question whether it was okay for the doctor to proceed with the trial if Ms. Hernandez went ahead and gave him the permission that she wanted to go ahead and finish the last two 21-day cycles, or if that would be unethical knowing that she was in declining health. My view to this in the case study is that Ms. Hernandez should be allowed to decide what she wants to do. If she decides to stay, they should not push her to withdraw. She knew what the risks and benefits of joining this trial were when she signed up to do it. So I believe that she should have a say in her part of it, and if that's the decision she wants to make, that she has the choice to do that. But I do believe that as the doctor, it is their responsibility to fully inform her of what the future entails, and they describe fully what life will be like if she does decide to continue on and finish out the last two 21-day cycles. But I don't think she should be pushed away if it's something she's passionate about finishing. I think that we could consider this to be unethical if we saw the patient themselves not capable of making a decision on their own and they had to have someone else. So if they were a child or someone who was physically not capable of speaking out themselves, then I could kind of see where that would get a little more iffy. But if they were able to fully understand and process what the doctor is telling them, then I think that it would be just kind of their decision, because they knew what they were getting into when they signed up for these cases or these trials, and I can kind of see why Ms. Hernandez would want to continue on to finish trial, because the drug that they are experimenting and trialing may be the drug that cures her and many, many others who are also suffering from the same thing as her. So I can see where she would be passionate about wanting to continue on something that could possibly be a major advancement in healthcare. So I hope you enjoyed this case study and my video. Thanks!